Welcome back. In this segment, we're going to show you the most effective way to get your current active patient base to refer their family and friends to your practice. Are you ready? We're going to teach you the right way to ask them. Now relax. For some of you, a cold shiver just shot up your spine. Wes, we don't want to be hard sell. We don't want to push people. We don't want to seem needy. Well, I've got a question for you. Are you selling? Are you pushing? Are you being needy? Or are you just asking a friend for a favor to refer another family member or friend? You know, it's interesting. I'll walk into a practice and I'll see a sign up at the front desk that says, your greatest compliment is the referral of one of your family members or friends. Now let's think about this. It happens for you all the time. Your patients go out and talk about you. What does that mean? It means that you earned their trust. That means that you provided quality care. That means that they liked you. And all those things enough to actually go to one of their family members or friends and say something to them on your behalf. They actually put their own credibility on the line to find somebody to come to your practice. Now, when I've gone around the country, though, what I've learned is that passive approach that way only nets about 10% of your active patient base helping you. So let's put this in perspective. Let's assume you have 1,000 active patients in your practice, and only 10% are actually going out and talking about you behind your back. They're saying good things and referring their family and friends. That means about 100 people. Now, I know some of those people will refer 2, 3, 4, 5 people. I got that. But it's only 10%. It's only 100 people. That means there's 900 people that have never talked about you or don't know how to talk about you. What could that do for your practice? So what we did is we created a tool to help you actually communicate better with your patients and make the request for a referral. We worked with a marketing company out of Salt Lake City, Utah, years ago to create something called a referral brochure. Now, the referral brochure is a small product here, has some information about your practice. There'll be a map on the back, your website address, current promotion might be in there, your phone number, everything they need. So when they give this brochure to someone else on your behalf, one of your patients gives it to someone else on your behalf, they know a little bit about your practice. Again, they can transfer the emotion of what it's like to work with you, but I don't know if they're qualified to actually send the marketing message about how in your branding and how you want to be represented in the industry. So we use this brochure. Now, I'm going to do 2 examples. The first example, I'm not going to use the brochure. I'm just going to communicate to one of your patients, and I'm going to ask for a referral. Then the second time, I'll come back and do it with the referral brochure. So here we go. Mary, it was great to have you in the practice with us today. I hope your visit with us was equally great. You know, Mary, we don't do a lot of outside advertising. We take a look, we serve our patients, we believe, at the highest level. And when they have an opportunity, we just ask them if they know anybody who's looking for a great practice, that they send them our way. Would you do that for us? Now, if you've done your job, and I assume that you have, Mary's going to say, yes, of course. Now, here's where it breaks down. It's better than the sign, but it's not as good as the brochure. Watch. Mary's going to walk out the door. And even with that request, Mary's going to go back into her normal life. She's got other priorities. She's got to stop and get something for dinner tonight. She might have to stop and get the kids for dinner tonight. She might have to go back to work. All those things are now a higher priority than your request. It's in the back of her mind, but it's not powerful. And she's just going to go about her day. Maybe it'll show up, maybe it won't. But let's do it now with the brochure and see what a difference it makes. Mary, it was great to see you in our practice today. I hope your visit with us was equally great. You know, Mary, we don't do a lot of advertising. We look at our great patients and expect that if we do a great job, and I expect that we did, that if they have family and friends that are looking for a great practice, that you'll send them our way. You know, we created this little brochure here, has some information about our practice. If you know somebody's looking for a great practice, would you give them that? Now, if you've done a great job, Mary's going to take that out of your hands, and she's going to be excited about it. Remember, the size of the brochure is small enough to put in a purse. It fits in a jacket. And when she walks out, she's going to have those same priorities, kids, food, work. But now she has this. And she actually made a commitment when she took that out of your hands. She made a commitment to give it to somebody else. And she will. But this is going to be a reminder. So she might get back to the office or someone at the grocery store or over on the soccer field this weekend. And she'll give this out on your behalf. So what do you do now? You practice. You go to our website, and you download a copy of this brochure. You get one made in the office, and then you start to practice, practice, practice. Watch this video again, so you get our verbiage, and actually read it off the documentation that comes along with it. And practice, practice, practice. On a daily basis, you practice your clinical skills, sterilization skills, front desk skills, everything. You need to practice this too. It's continuing education. Now here's what you get for your efforts. Remember I said earlier in this video is that only about 10% of your current active patient base refer right now in your passive method with a little sign. Well, I'm going to guarantee an additional 10% minimum of your patients will now refer your practice because you ask them, and you ask them properly. So we started out with 1,000 patients. 10% more patients would be another 100. The American Dental Association says the average patient in your practice is worth about $820. Well, if I have 100 additional patients at $820, that's $82,000 of production collection revenues to your practice every year because you got out of your comfort zone and you asked them for a referral as opposed to just waiting to see if they'll do it passively. This is a great program. We have practices that this is it. This is their only marketing campaign. They don't have any other external. They have a website, but they ask their current patient base because their current patient base is going to bring in people just like them, and that's what you're looking for. Patients that are just like the great patients currently in your practice. Get yourself a brochure and ask for a referral.